Your lives.
So, good afternoon, viewers. Myself, I am Dr. Vijay Chenna, Senior Consultant Neurologist working at KIMS Icon Hospital, Shilanagar, Vishakhapatnam. So, today afternoon, I would like to discuss regarding the brain health and prevention. So, every year, July 22nd is celebrated as World Brain Day. So, regarding the World Brain Day, I would like to discuss certain issues. Every time we discuss regarding the treatment aspects and how to treat patients, what are the newer technologies, what are the newer interventions in that way. But why do you want to do a newer intervention when we can prevent the disease itself? So, certain things, if we follow, most of the diseases for the brain can be prevented and improve our brain health. So this is today's topic. So in short, we can tell that our brains are the command center of our bodies, responsible for controlling every movement, thought, and emotion. Yet many of us neglect to prioritize brain health until the problem arises. So the neurological disorders representing a significant global health concern impacting the individuals and societies across the globe. With billions of people being affected and millions of people lost each year, the burden of the neurological disorders cannot be overstated. Despite advances in medical science, disparity in access to the quality of care it persists, underscoring the urgent need for comprehensive prevention strategies. So, a concept of World Brain Day was initiated by the World Federation of Neurology. This was started in 2014. It serves as a platform to raise the awareness and advocate for improved neurological care worldwide. In collaboration with six global regions, the World Brain Day 2024 focuses on brain health and prevention this year, aligning with the global agenda to combat the disability and promote the well-being of the patients or the population. So, as I told this year, 2024, the World Brain theme being brain health and prevention, the mission is to address the risk factors for neurological diseases proactively, emphasizing the importance of early detection and effective management and disseminate the global education on various preventive strategies. So, the WHO, the World Health Organization, in its operational definition, prevention is defined as specifically disease prevention and health promotion. So, the disease prevention involves specific interventions on both population and individual levels, addressing the primary and secondary prevention to mitigate the impact of diseases and associated risk factors. So there are different types of preventions like primary prevention, secondary preventions. The primary prevention focuses on averting the onset of the disease, incorporating measures to enhance health by addressing the various social and economic determinants. The secondary prevention emphasizes early detection to enhance the positive health outcomes. This includes evidence based screening programs for disease detection and prevention of congenital malformations, along with administering the proven effective preventive drug therapies in the early stage of the disease. Like the we try to screen the populations various congenital malformations happening in different parts of the world are to be screened properly so that the disease does not propagate into the next generations. The global burden of disease study in its latest findings highlights the preventable nature of many neurological conditions, emphasizing the importance of targeted interventions. The various neurological diseases like stroke, Alzheimer's disease, and various other dementias, they are among the most extensively studied conditions with identifiable risk factors that offer opportunities for prevention. So there are five key messages in brain health and prevention. So as we have initially talked about the prevention itself, the main important part is the primary and secondary prevention of the various neurological disorders. So the neurological disorders are preventable through early detection and effective management. So we have to invest in those areas of early detection measures, which will definitely and significantly reduce the burden of these disorders. It involves providing information on behavioral and medical risks, implementing the community level interventions, offering nutritional and food supplementation, promoting the oral and dental hygiene, delivering the clinical preventive services like immunization to children, adults, and the elderly. This will definitely impact the brain health and prevent the major morbid diseases caused by various neurological disorders. By understanding the risk factors, taking proactive steps, we can still maintain the optimal brain function and reduce the risk of cognitive decline. So, there are several risk factors which are modifiable and non modifiable. The non modifiable risk factors like age, the gender, which cannot be changed uh, because as age grows, the brain gets atrophied and the memory is hard to lose. But to make it delayed or to make it young, we need to take certain proactive steps. So lifestyle choices are very important, and the activity, physical activity, then habits like smoking, alcohol consumption, and the modifiable risk factors like health conditions or the medical conditions like diabetes, hypertension, psychological disorders like depression, they should be avoided or addressed appropriately. So we will discuss about some preventive strategies. So as we told that physical inactivity is one of the important the progression for the brain diseases. The important first strategy should be exercise. We need to exercise regularly, and the physical activity boosts the brain health by increasing the blood flow and promoting the neuroplasticity. Then the second part is the social engagement. As age progresses, many of the people feel that after 60 and 65, they get retired and they need to take rest. But building a strong relationship post the age of 60 or 65 will help their memory to be boosted up and their mental health to boost up. Staying alone in the house only with the family members and not having total social communication may decrease the cognitive function, because the communication with the social being social and being communicative will stimulate the cognitive function. There should also be mental stimulation from childhood and also throughout the age and even in the older age groups. The challenging with the brain with learning, puzzles, and creative activities is much more important. The next important part is the nutrition and hydration. We have to fuel our brain with a balanced diet which is rich in fruits, vegetables, omega 3 fatty acids, and we need to stay hydrated. Per day, depending on the age and also the weight, we need to at least have from 2 liters to 4 liters of water. Post nutrition, the important other part is the sleep. The relaxation of the brain is very much important. We need to aim at a period of 6 to 8 hours of sleep and practice stress reducing techniques like meditation, yoga, cycling, swimming, running, gym. But although any of one of them can be done, it should be done regularly. The regularity is more important than doing once a week or once in a month. So monitoring and managing the health conditions. We have to work with the healthcare provider or the doctor to control the chronic conditions. Many of the population in India are either affected with diabetes, hypertension, hypothyroid, or many other medical conditions. These have to be constantly monitored by self and also with the doctor, with their family doctor or the healthcare specialist who involved, and this has to be monitored regularly. Finally, we need to avoid the harmful habits like smoking and limit the consumption of the excessive alcohol and also certain harmful drugs which will affect the whole body, especially the brain. So, after discussing about the prevention strategies, maintaining the lifestyle, controlling the risk factors, the other things which are important in the brain health and prevention of its adverse effects is awareness. So, awareness should be done through education on several parameters. It should be like a global imperative. Spreading awareness about the importance of adopting a proactive approach to brain health is crucial in reducing the incidence of preventable neurological disorders. We need to arrange like literary programs. We can arrange even competitions for fine arts, like encouraging the artwork, poetries, essays centered on the themes of the brain, consciousness, or neurological disorders from the primary school level, which will help the brain health and also its prevention of various disorders. We can also arrange like student musicians to perform school sponsored brain programs and tie their performance into a neuroscience topic, and we can tell them that the effect of music on the brain and how it helps in improving the cognitive functions. So after education, we also need to the accessibility of these various health programs to the general population. So socioeconomic status or the geographical location, it should not be any barrier to the prevention of any brain health programs. So we need to ensure equal access to preventive measures, which is essential in creating a more inclusive and equitable healthcare landscape. So we can see that socioeconomic status can influence various mediators like prenatal factors, parental care, cognitive stimulation, and other factors. So we can see that with people with less socioeconomic background, they suffer from various nutritional defects. Even anemia is a common thing during the pregnancy. We need to give them regular supplements, and the food has to be regularly supplemented, and prenatal checkups has to be done. Over the counter prenatal drugs have to be avoided. And in the other part of the socioeconomic status, like having alcohol exposure to the smoke, this has to be prevented. And also the pollution, environmental pollution, flames, drugs, which are very being common, exposure to the air conditioners and all. This has to be controlled or tried to be prevented as and when required, which can influence the prenatal or the parental care and the cognitive functions. So these all affect the brain development and the cognition and academic achievement, and also influence the mental health. So the each of the programs which will affect the socioeconomic status may can affect directly or the affect indirectly by the candidate mediators, and also the brain development through strategies that include training of specific neurocognitive functions. So we also need final collaboration like healthcare professionals, researchers, policymakers to play pivotal role in addressing the global neurological crisis. So through collaboration, we can leverage collective expertise and resource to implement effective strategies for prevention and management. So various NGOs or the government institutes or the government schemes, and also the private corporate has to involve in incorporating all these the prevention programs to the root level, where we can help in educating the children and also the general population about the gender's brain health and also preventing its diseases. The education is an important part of the brain health prevention. Recognizing the brain health as a fundamental human right is at the core of the mission. The education and advocacy efforts must be intensified to ensure that every individual will have the knowledge and resources to prioritize and maintain their brain health. So we need to have a control of our own brain health. We should need to have a regular health checkups. It can be annually, depending on the work of the particular person. At times, if he is working in an hazardous industrial areas, he may require it periodic checkups. Or if he is general population where his work is not so much stressed, he may require an annual health checkups. So, constant communication with the personal family doctor or the healthcare provider is very much important. The healthcare provider need not always be a doctor. Sometimes it can be even the ANMs at the village level, even at the other healthcare workers who are taking care of these various programs, immunization programs, like, and of them have an equal part in maintaining the mental health, or in particular the general health of the patients. We need to stay mentally active, get engaged, prioritize the sleep, self-care, making a healthy lifestyle choices by taking proactive steps. We can maintain the optimal brain health and reduce the risk of cognitive decline. So various diseases the strokes, whether it is ischemic stroke or the hemorrhagic stroke, we need to maintain a very healthy lifestyle, have a constant look after our regular dietary habits and regular exercise, and by that we can maintain our regular brain health. So this is the regarding the prevention strategies where we can try to improve our brain health, and because healthy brain is a powerful tool and we need to take care of it. Thank you. So as we can see, we have a question like, how does exercise impact the brain function? As I have already told in the my lecture, exercise will improve the blood flow to the brain. The increased blood flow will help in increasing the neurohormones like serotonin, dopamine, and several other hormones to increase, and will help to keep the brain neurons active, and the neuronal as we can say that brain is a neuronal circuit. The circuit acts better, helps to keep the general body very healthy. So one more question we have, that are there any specific exercises or activities to improve the memory? So like yoga, meditation is a regular routine exercises where we can do, and we a 30 minutes of a regular treadmill exercise or jogging will definitely improve the memory. And certain activities like I already told, Sudoku puzzles, regular crossword puzzles will definitely help to improve the memories. How can I improve my memory and cognitive function? So, as I've told, it is not a single individual step where we can directly improve our memory and cognitive function. It starts from like our childhood. We need to engage in different educational activities and try to improve our brain health from the earlier age. We need to know what is a brain, what does it do, what will it help. Then, as I told, the risk factors, modifiable and non-modifiable risk factors, where we need to have concentration on them, have regular checkups if they are affected with any of these modifiable risk factors like diabetes, hypertension, and all, and avoid the smoking and excessive alcohol, and maintaining a regular physical activity with all the mental activities, we can improve the memory and cognitive function. And finally, if some patient has some memory disorder which is age related, there are drugs now which can at least delay the further progression of the disease. And there are many what do you say, research going on to develop vaccines to prevent these memory diseases. So, is there any supplements that can boost brain function? Yeah, there are. I don't believe in artificial supplements, but we need to rely on the natural supplements where the like fruits, dry fruits, which will have a lot of omega-3 fatty acids and antioxidants that will definitely boost the brain function. And all of them being natural will definitely help it. And if someone who is like a vegetarian, thyroid, we can then give them supplements which will have methylcobalamin, pyridoxine, and other multivitamins, so that it can boost the brain function. How does aging affect the brain health? So as age progresses, what happens is like our skin and other body parts where we gets degenerated, even the brain also gets atrophied. So once brain gets starts to atrophy, the neurons they get damaged and the neuronal circuit doesn't complete out. So this will affect the brain health. So as age progresses, we know that atherosclerosis, which starts from day after the birth because of the age, and also with the add-on like environmental pollution and all various metabolic disorders, the vessels get blocked with the fat. So this fat will will block the vessels, and blocking the vessels will decrease the cerebral blood flow to the brain, and it will lead to either a hemorrhagic stroke or a ischemic stroke if the blood pressures or sugars are not well maintained, and finally affect the brain health. Does brain training apps helpful? I have heard only about a few of the brain training apps, but we can say that see, everything on a mobile makes it as addiction. So uh, we can use apps, but we need to fix the screen time. So the screen time is very much important, because doing it on a paper will make you brain think more rather than doing it on a mobile app. So it will be helpful, but we should be cautious in how much time we are spending on that apps on the mobile. So how can we keep our brain active as we age? I have the complete topic is on the same thing. So right from vaccinations at the birth age, later in the school engaging in different activities, physical and mental, and regular exercise. If an adult who develops any medical disorder, need to monitor those parameters, have a regular contact with the healthcare provider who is nearest possible, and take their suggestions and also the medications if required, and being social, mingling with different kinds of people, talking with them, and trying to be positive will make the brain active although we age. Are there any specific brain health screenings available? Yeah, there are brain health screenings available. That depends on what type of symptoms are the person is facing. So if you have severe headaches, regular continuous regular headaches which is bothering them, we need to do imaging techniques. There are certain investigations which we can do, like other cardiac and all. We can do brain routine health screenings. Like all the routines can be done, like hemoglobin, random blood sugars, then creatine levels, the B12 levels, vitamin D levels. All these parameters can be screened for the brain health. Natural remedies, as I have already mentioned, they are the physical and mental exercises which has to be done, and also the diet which could be rich in more of antioxidants and omega-3 fatty acids. So that part of the diet, if it is more, and avoiding fast foods and processed foods, are the natural remedies for improving the brain health. Common risk factors, I already told, age itself is a very common risk factor. Then habits like smoking, excessive alcohol consumption is one more risk factor. The medical conditions like hypertension, diabetes, then the thyroid abnormalities, they are also common risk, and obesity, the lack of physical activity, inactivities, they are all common risk factors for brain diseases. Sleep, I have already mentioned that 6 to 8 hours of quality sleep is important for the brain function. Once you don't sleep for a quality sleep for 6 to 8 hours, then morning, the next day morning will be more of lethargic. You can't concentrate on your regular duties or work. It will affect your driving, your processing, your regular work activity, and also it will finally cause a problem the output of what you have to do. So definitely the brain function is affected by sleep quality and also the quantity. So frequently I forget some things. Is this dangerous? Please tell us any medication or treatment would be required. So there is two things regarding memory loss. Generally, memory loss, what we tell is what we receive from patients is the from the bystanders, like the family members, attenders, the colleagues from the work. They tell that he is forgetting. So that is definitely a memory loss according to me. But when we say that I am forgetting so many things, and your age is around from 20 to 40, it is not a significant memory loss, but you need to get it checked. I say that it is more like of an attention problem. So we try to engage in different activities, and we try to leave the concentration on certain particular activity. We try to stay on one work and try to think on a different work. So that is how we forget things. So regarding for this medication or treatment, first we need to get evaluated. So certain things like they are reversible memory losses, like B12 deficiencies, folic acid deficiencies, thyroid disorders, where we need to give them supplements and medications for them. Certain rare disorders can also cause memory losses, like small clots, small space occupying lesions, where injection is required. Before concluding on what has to be done or what has to be done, you need to consult a healthcare provider, so that he will decide for you and make your life easy, rather than being in a confusion and trying to check it online. Thank you.